Thank you so much, Madam Speaker, and thank you, Mr. Burgos, for yielding me the customary 30 minutes. Madam Speaker, today, while we stand here debating this rule, the Republicans' default on America plan is holding Americans hostage. Across my district and this country, Americans are wondering what will happen to their food security. How about their Medicaid? What about veterans' health care? Republicans are holding us hostage so they can protect the tax cuts that they gave to the wealthiest corporations and millionaires. We need to remember that that debt that we are looking at today was incurred by Republicans during the Trump administration, $7 trillion of that. And you know what? If they crash the economy, it's not the millionaires who would hurt, it's working families. The Republican default on America would impact the very bills we will be talking about today. It would cut funding to fight the fentanyl crisis, treat addiction, reduce pollution, and help Americans pay their bills when pandemic hits. The rules we are considering today will make in order 3 bills. The first is H.R. 467, the HALT Fentanyl Act. We all agree that there is a scourge of fentanyl in our communities, and we all agree it needs to be stopped. There is no district in our country, and no family, and no community that hasn't seen and experienced the horrors of fentanyl. The problem is that this bill isn't going to do what needs to be done to address the fentanyl crisis. To fight the fentanyl crisis, we need more law enforcement funding, and we need to treat addiction. Right now, as noted, fentanyl-related substances are listed on Schedule 1. That listing goes through the end of 2024. So the main thrust of this bill is to make that listing permanent. But our communities are pleading with us to do more than the status quo. For decades, we tried to incarcerate our way out of addiction. But addiction is a disease, not a crime. And I am speaking from the heart. I know most of my colleagues on this floor have heard that I lost 2 brothers to addiction, 2 beautiful souls that were taken from this world far too soon. And it was partially because there was no treatment available. This country has failed to treat addiction as the health crisis that it is. So I know personally the pain that fentanyl brings to our families and our communities because I felt that pain when my brothers passed away. And treatment for addiction can save precious lives, but we lack the capacity to provide those services. Instead, the Default in America plan that their crisis is creating would cut funding for mental health and addiction treatment services. H.R. 467 would also expand mandatory minimums, which takes away discretion from judges to look at each case on its own. This disproportionately harms Black and brown communities more than others. Last night in rules, Republicans rejected 37 Democratic amendments that would have added more law enforcement funding to interdict fentanyl at border crossings. It would have provided more evidence-based approaches to fentanyl use, and it would have made sure that we have the tools we need to treat addiction. Instead of finding solutions, Republicans are creating more problems. The Republicans' Default in America Act will cut funding for customs and border protection, potentially leading to an increase in the amount of fentanyl hitting our streets. Is this their way of addressing the fentanyl crisis? We need to do better. We need to make sure we give real solutions to these very serious problems. And I am tired about hearing that Democrats are to blame for the fentanyl crisis. We all recognize the need to do more. But let me remind us that in the last 2 years, the Biden administration has seized record amounts of illicit fentanyl at the border. DHS has seized more than 35,000 pounds of fentanyl in fiscal year 2022. The Department of Justice disrupted or dismantled 130 fentanyl networks. The administration is expanding access to treatments for those suffering from addiction. Democrats in Congress passed a funding bill last year that beefed up resources for the High-Intensity Drug Trafficking Areas Program. the National Guard Counter-Drug Program, and the Drug Communities Program. Contrast that with the Trump administration. A GAO report blasted the previous administration for failing to come up with a coherent national opioid strategy, and the crisis spiked. In the first 2 years of the Trump administration, we saw significant spikes in the fentanyl crisis, and more people died. According to the CDC, the annual number of overdose deaths from synthetic opioids increased by 192% between 2016 and 2020. In contrast, since day one of this administration, President Biden has provided solutions to address the overdose crisis. Madam Speaker, I seek unanimous consent to enter into the record the December 2019 GAO report. The Office of National Drug Control Policy should develop key planning elements to meet statutory requirements.
Without objection.
And this report highlights the GAO of the failures of the last administration in addressing this crisis we are talking about today. The rule also makes in order 2 Congressional Review Act disapproval resolutions. HJ Resolution 45 would roll back the student loan payment pause to last October. It would create chaos and instability for millions who are living check to check. Let's remember why student loans were paused in the first place. Let's remember how dark and horrible it was when the pandemic first hit. Remember how scary it was when COVID-19 started and the economy was in a free fall? People lost their jobs. They were struggling to pay rent, and we didn't know what the future held. A pause to student loan payments was the right response to a public health emergency that was also a financial emergency. The payment pause was a lifeline for 37 million borrowers and their families, giving them much-needed breathing room to pay their bills, to pay their rent without worrying about sabotaging their credit. HJ Resolution 45 could send surprise bills for interest to tens of millions of Americans. This could lead to unprecedented delinquencies and defaults for most of these vulnerable borrowers. The third bill, SJ Resolution 11, would reverse an EPA rule that reduces air pollution from the trucking industry. Many parts of America were once cloaked in air pollution that would sit at street level, sting your eyes, fill your lungs, choking air, they called it. So in response, we enacted the Clean Air Act and tasked the EPA with cleaning up our air. But still, 1 in 3 Americans live in counties with unhealthy air pollution. Heavy-duty vehicles make up about 6% of vehicles on the road, but generate 59% of these dangerous pollutions that we're talking about. This contributes to respiratory illness, cardiovascular problems, and even death. The Clean Air Act gives the EPA both the authority and obligation to protect Americans from air pollution that could endanger public health or welfare. And that's exactly what EPA's heavy-duty engine and vehicle rule would do. Republicans want to block the EPA rule from going into effect. And even worse, if this passes, Republicans would block EPA from regulating this pollution in the future. Why would we want to keep this agency from doing its job, from keeping us healthy? So instead of putting polluters first, Republicans should be spending this week paying America's bills. It's the patriotic thing to do, but clearly that's not their priority. Remember, a default hurts working-class Americans. It hurts seniors on Medicare, food assistance recipients, teachers and students, access to care. And if you are still waiting for your tax refund, it might not come. Democrats have signed a petition to bring to the floor for a vote a bill that would raise the debt ceiling without any harmful cuts to the programs Americans rely on. All we need is 5 moderate Republicans to join the petition, and the default crisis would be over. I reserve.